All right, so in this video, we're gonna look at sacral extension, all right? And we're gonna go through a progression that starts out least aggressive and then kind of ultimately gets, some clients really need to work into maximal sacral extension, but you just wanna make sure there's no extension sensitivity there, okay? So we're not trying to just like crazily compress her facets of her lumbar spine as well as L5 onto S1 and create a lot of pain. But other people really need this. Okay, so the first thing I'm going to do is just a little spring test kind of throughout the sacrum to just kind of feel where in the sacrum doesn't want to extend. Okay, and I'm kind of mobilizing them in the direction of extension. All right, so it's not just pure PA, but it's a PA with the ability to improve extension of the sacrum. All right, and so right here, right at her mid-sacrum is the biggest restriction. All right, so I could use my hypothenar eminence to block it. I could also use kind of a key grip to block it, or I could use a snowman with a hat, which I don't think I have on hand right now. So I'm going to use the heel of my hand here. And the first thing that I'm going to have her do is we could just have her breathe, right? But that's neutral, right? So that's just working PA, basically PA mobilization in neutral. So in order to actually work into extension, we need to either have her, let me just feel your motion here, okay? Need to either have her actively bend and extend her knees. It comes to pressure, you feel how it comes to pressure right there, okay? And then come off a little bit and then back on. And so I can maintain that into extension just with her active motion. The next thing I can do is bring her into that, where that hard infield starts to increase, and then hold here, okay, don't let me bend you, right there. And then I just block there, and that kicks right into my hand and let it go, okay? And I can continue to work into greater amounts of knee flexion, working on relative sacral extension. The next thing I can do is, okay, go ahead and prop up on your elbows. There we go. So that pre-positions her into a little bit more extension. Now I can have her do the same thing. Bend your knees up. There, good. Pressure on, pressure off, back and forth there. I can do the same thing here. Hold there. All right. So that's pre-positioned into a little bit more extension. Now I could also have her engage her forearms into the table from above. Okay, so that's an option. That's a kind of the lower amount of pressure or lower irritability option. I could have her bend your elbows up, or bend your knees up, all these body parts. There we go, to there, okay? And now I can have her hold here and press her elbows or forearms down into the table and let it go and work into more extension that way, okay? The next thing I can do, go ahead and lay flat there, okay? I can have her actually bring her hands underneath her shoulders. There you go. And now go ahead and press up. Good. And back down. And so you can kind of coach them, slowly press up there, right there, okay, is where I get that infill come down just a little bit and back up, okay? So I don't want her to necessarily blow through the infill of my hand as she presses up. And so she could just work, you can go ahead and relax down. She could work on up and down from there. Now finally, I could bring her all the way here. Now go ahead and put your hands underneath your shoulders and press up there, right there. That infill is engaged. Now don't let me move you here. Good. So now we have her pre-positioned into the infill and relax down. We have her pre-positioned into the infill from above. Then we bring up the slack of her legs until we feel a greater infill into the hand, and then we use our functional mobilization of knee extension in the most aggressive position that we want to be in. The one other thing that I'll mention that we can do as a variation off of that is I could have her bend the elbows up, or bend the elbows. Second time I've said that in this video. Bend the knees up. So I have her, this is loosening up. I have her here at her infield. Now hands underneath your shoulders again and press up there. Good. Hold here, and then I could have her move her upper body down and up with the press up. Yep, and then press up. That's it. And it's just about which, does the upper body help the sacrum to release better, or does the lower body help the sacrum to release better and relax down? And you just kind of have to feel that for yourself. So I'm giving lots of options, and there are many clients, again, that are extension sensitive, that you'll never progress to this kind of in-range position, especially if people have significant amount of facet extension sensitivity or arthrosis. But this is a progression that you can do to help with sacral extension.